staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
You're young.
Today we have an important guest, Dr. Disick, specializing in urology, and we're going to get to know him. And first I wanted to ask you, how did you decide to get into your background?
I was always interested in medicine growing up, in science. I kind of was drawn to surgery. Entered medical school not really knowing what field of medicine I was going to end up being in, but I really, really enjoyed the surgical fields. And after spending some time in the various surgical subspecialties, I became more interested in urology.
I see.
And I thought it was a really good mix of medicine and surgery, small surgeries and big surgeries. And you can follow patients over a very long amount of time, not like a quick surgery and you never see them again. So that's how I got interested in it.
That's great. I also, wanted to know more about your residency and how that experience was for you.
I did residency at Mount Sinai Hospital in New York, which was a great place to train.
Yeah.
I did 2 years of general surgery there and then 4 years of urology.
Oh, wow.
And when you're at Mount Sinai, or at least when I was there, we were rotating at lots of different hospitals in the area. I trained also at the Bronx VA,
Wow.
at a city hospital in Queens, Elmhurst Hospital, and I spent some time at Memorial Sloan Kettering as well, which is obviously world famous. And then after my residency at Mount Sinai, I spent a year doing robotics and laparoscopy at a hospital called Hackensack University Hospital.
I've heard of it. I'm actually from the Bronx. So,
It was great. That's in New Jersey. And then I ended up coming down here.
That's great. How long have you been here?
I started here in 2008.
Wow, so you've been here quite a while. You're a Floridian now.
Yeah, I love it. Yeah.
Can you tell us a little bit more about what the latest advancements are in urology?
There's a lot going on that's new in urology.
Tell us more.
There's a lot going on in robotics and in laparoscopy. Robotic surgery is really become huge in the field of urology.
Okay.
There's a lot of advancements in prostate cancer screening and prostate cancer diagnosis, prostate cancer treatments. We have a lot of new treatments for kidney stone surgeries.
Right.
We're using lasers, and it's a big shift to minimally invasive treatments and surgeries across the board.
Okay, that's interesting. I wanted to know also, at what point does a patient say, okay, it's time to call Dr. Disick's office, I should probably go in, I have some concerns?
So a lot of men come to see me, obviously, but I do see about 40% women. Men come when they want to get screened or discuss screening for prostate cancer.
Okay.
I treat a lot of men with urinary problems, which is called BPH. So if they're having some problems urinating or they're peeing too much, if they have problems with erectile dysfunction, a lot of men come now asking about low testosterone levels. And I do treat a lot of patients with kidney stones.
Right.
And obviously that's more of an emergent basis.
Right.
And I see a lot of young men
Yes.
when they want to talk about vasectomies.
Okay.
So we do a very wide range of
Right.
treatments and,
Right.
and a wide range of conditions.
Right. Yeah. A lot of people sometimes think urology and think just the older crowd, but it's not really the case now, is it?
No, it's not just seeing an old man. It's you're seeing women,
Right.
you're seeing women with urinary infections and overactive bladder. They come to see me, and like I said, young men too who have questions and things they want addressed.
I see. Okay. So, how exactly would the patients get in touch with your office if they wanted to come in for a screening?
You can find me on my website. It's gdurology.com.
Okay.
And then my office is, I have an office in West Boca and an office in Delray, and you can call 561-487-5506 and just ask to make an appointment. I mean, that's the best way to start.
Okay. Thank you. I wanted to talk about more prevention also. What tips do you have for, let's say, women struggling with urinary tract infections or even kidney stones? Is that something that is derivative of having a bad diet, or?
It can be. One of my specialties, I guess you could say, would be kidney stones because of my fellowship.
Okay.
Kidney stones can be diet-related, but may not be. Once you've treated someone for a kidney stone, or if they've had stones in the past, there's blood work and a urine collection. And the urine collection is called a 24-hour urine collection. So you collect your urine for 24 hours.
Wow.
And yeah, it
Sounds
sounds kind of weird. And we send it to you, a big jug, and then you send it to this company, and they send me a 5-page report, and it shows why are you forming kidney stones. And some of that can be diet related, and we have multiple diets you can follow. Some of it needs medications.
Okay.
And the goal is to modify your risk so you don't go through passing a kidney stone, which is extraordinarily painful and,
Right, I
and
can
an
imagine.
awful
I've heard.
experience.
Yeah.
It's pretty bad.
Yeah. So how do you avoid the kidney stones again?
Well, the main thing is drinking water. I mean, we're what's called in the Stone Belt of the United States,
Right.
where our location is. So
Just
drinking
gonna
lots of
take a sip of water.
drinking lots of fluid is the main thing. Avoiding salt in your diet, that's huge.
Right.
And then there's a couple other.
Are there foods that you can eat
can
that will help?
The one thing that may help is lemons.
Oh, okay.
Yeah, lemons are very, very high in citrate, which is a stone preventer.
Oh.
So I tell a lot of patients to go on lemonade therapy, which is a legitimate treatment for kidney stones. The problem is that they go and buy the store-bought lemonade, which is so high in sugar.
Or they put like a cup of sugar into it.
Yeah, so I tell them just, freshly squeezed lemons and squeeze lemons onto your food. So that's one of the things, and it's just kind of avoiding certain foods, and it really
Like
depends.
which ones?
Well, it depends on why you're having kidney stones. So you can't really make a blanket statement.
Right.
That's where it gets dangerous.
That's when they have to come in.
Yeah, they have to come in, and I have pre-printed diets and all that for them to follow.
Right. Okay, that's great. Would you say the kidney stones are probably one of the most common conditions that you treat at your office?
Yeah, I think that kidney stones,
What else?
prostate cancer,
Okay.
bladder cancer.
How do we watch out for that? How do my
Prostate
gentlemen watch
cancer?
out? Yeah.
That's a hot topic, and
Let's talk about it.
so right now, the main thing we use is a blood test called a PSA.
Okay.
And it is a blood test that detects proteins made by the prostate.
All right.
And in higher levels, that could be a sign of prostate cancer. The question is, and where the controversy is right now, is who should get that PSA and at what age? Some of the people now are starting to think, well, we shouldn't even bother with this test because it's leading to a lot of unnecessary biopsies and unnecessary treatments. As a urologist, I really don't agree with that.
Okay.
But basically, when you start hitting your 50s, you should start talking to your primary doctor first about PSA testing and rectal examinations. And if these are abnormal, those are when the people get sent to me. Someone's got a primary who checked their blood test, it's not normal.
Right.
Or the primary doctor thought they felt something abnormal on an exam. Those men get sent to me, and then I counsel them on what are the next steps you take. How do you interpret this PSA? And there's even newer tests. One of the most interesting ones right now is called a 4K test,
Okay.
which is also a blood test. and it tests for new proteins in the blood, and it can predict the risk of having an aggressive prostate cancer. Plus, we're starting to do MRIs on people with prostate issues, and that can aid us in deciding basically who needs a prostate biopsy once you have an abnormal PSA. And men are very reluctant to want to undergo a prostate biopsy. I mean, the word prostate biopsy sounds awful, and
I can imagine.
Brings up a lot of bad images. But the truth of the matter is that that's the main way we diagnose prostate cancer.
Yeah. So how often do you think an individual should come and see you once they feel like they have signs of?
Well, if they're having symptoms, obviously they need to get and be seen right away, and that's kind of the scary thing about prostate cancer, because you may not have any signs at all. It may literally just be your blood test was abnormal, and then you can be diagnosed with a prostate cancer if that level was abnormal and the prostate biopsy was abnormal.
Right.
So the first step is really, if you want to get screened, talk to your doctor and decide whether or not the PSA blood test is for you, and get examined.
At what age do you think?
So that's really where the controversy. So the American Urology Association right now has said that men under 40 do not require screening.
Okay. How many patients under 40 have you seen?
Not many coming for that unless they have a strong family history.
I see.
And in the 40 to 54 range, again, that's not yet across the board recommended unless they have a high risk of prostate cancer, meaning they have a first-degree relative like their father or their brother.
Right.
Or if they're African American, because those people have a higher risk of prostate cancer.
Okay.
In the 55 to 69-year-old age, that's the real key age where prostate cancer screening should be seriously discussed. And the American Urology Association says it should be a shared decision between the patient and the doctor about whether or not they want to have their PSA tested. I'm a believer in it, and I do recommend it for patients in that age, at least once a year or every other year, depending on what the value is.
Okay, that makes
with
sense.
An exam, of course.
Right.
But that's a huge. I mean, I'm seeing lots of patients for that, as every urologist does.
Right. Yeah, I mean, it's definitely something that should be spoken about more often.
Sure.
Especially to younger folks, because I feel like, they don't really know exactly what dictates them.
No, that's true. If they've had their father, or if they had an uncle, or their brother have had prostate problems, they should get screened early.
Mm-hmm. And getting screened, now, does that occur with their primary, or
it can be?
Can they come directly to you?
Yeah, they can come to me, or they can go to their primary doctor. I mean, I do it all the time.
Mm-hmm. And you work at West Boca also, correct?
Mm-hmm.
How's your experience there?
It's great. It's great. I do a lot of surgeries there. I see a lot of patients there.
What is the most common surgery?
Probably kidney stone related surgery. I do a lot.
What does that entail?
So it really depends on where the stones are, how big they are. But the main two big surgeries do. One is a shockwave lithotripsy treatment, where we use sound waves to blow up a kidney stone. If it's in the kidney, we really don't even have to. We don't have to touch the patient. I mean,
that's amazing.
We just use sound waves. And then for other stones, we do have to go inside with small flexible cameras and use lasers to blow up the stones. That, and then people who have bladder cancer or who have urinary problems from their prostate, those are a lot of surgeries that we do as well.
Okay. Sounds interesting. In regards to the women, what tips would you give them to avoid UTIs?
Yeah, it's hard. I mean, a lot of women have these old tales of cranberry juice and bathing suit use.
Let's talk about the cranberry juice, because I'm a firm believer in cranberry juice.
The cranberry juice, everyone thinks they're like helping themselves out, but I really don't believe in it too much because of the data. the problem with cranberry juice is that the juice is very acidic, and these people are chugging and drinking, so they're peeing more, right? And then the juice is very acidic, which can aggravate the inflammation of the bladder. So for women who are really compelled to want to take cranberry juice, I tell them to take the cranberry extract pills.
Do you find that is better?
It's a little helpful. I mean, the data, again, there was a big study, and it didn't really show too much of a benefit. I also tell women to take a probiotic.
Okay.
And then some women need some vaginal creams like Premarin or Estrace because that can contribute to recurrent urinary tract infections. But most of the stuff that women come in is old, voodoo that's not really accurate. And I have to kind of...
What's the most outrageous thing you've heard?
Like hot tubs and getting out of their bathing suits right away and stuff like that.
Yes, I hear that all the time.
Right,
Is
everyone's
that not
been
the case?
taught that, and it's probably not true.
Oh my goodness! All this time.
Right. There's a couple of studies that show that cinnamon has been helpful, but
really,
yeah.
Very
There's not much. There's not much.
Not many.
No.
I'd rather take my chances coming to your office and letting you decide. So, so surgical procedures we covered. Is there anything else that you wanted to talk about?
Well, for women who have, a lot of women come with some of the symptoms of overactive bladder.
Okay.
And some of the stuff that we're doing in overactive bladder is pretty interesting. There's a lot of medications that are available.
Okay.
And
over the counter or
no prescription medications that can help with some of that frequency and some of that urgency. And interestingly, we're doing Botox injections in the bladder.
Really? Tell me about that.
So
that sounds interesting.
It's like a 15-minute procedure. We do it in our office, put a little camera into the bladder, and then inject about 20 little spots of Botox, the same Botox that people are using for other stuff.
I've heard of it being used effectively for migraines. Yes, but I've never heard of it being used in urology.
It's being used a lot in urology for overactive bladder. I have a lot of patients that it works for, and it lasts for about 6 months.
Okay.
And it's getting these women off of their medications because the medicines can have side effects and they're expensive. So they come in every 6 months, and we just do this 15-minute procedure, and it can help them.
Is it painful at all, or?
It's mildly uncomfortable, but they're awake and they drive themselves home.
Okay,
Yeah.
so it's minimal.
It's minimal. And we're doing a lot of testosterone work.
Tell me about that, because I hear a lot about that in all different types of settings, whether it be the gym or
a lot of men now come thinking, I want to get checked for low T.
Okay, low testosterone.
And there's a lot of these, wellness clinics that are all over the place that I obviously am not a huge fan of. But
of course not.
A lot of men come wanting to talk about that, and we do blood work and examine them, and I go over all about testosterone treatments with them and decide whether or not they're a candidate and want to embark on testosterone replacement.
Right. Now, would you say that that's the difference between yourself and these quote-unquote wellness clinics?
Me and my urology colleagues and I are not enamored with these clinics.
Why not?
We don't. They're not board certified in urology. I think they view testosterone as a vitamin that just should be replaced.
Right.
And there's really a lot more that goes into it, and there can be some side effects. So we really recommend you see a urologist, or at least talk to your primary care doctor about that first. And that also goes the same for erectile dysfunction. A lot of these clinics are offering, they're selling their own products, and they look at these patients as consumers, not as patients.
Right.
And they claim that they're in it for wellness of the patient, and I just find that very hard to believe.
Right. Do you find that they do take the extra step into doing the labs, the blood work, everything that you need in order to know what the balance is, right? You need to know exactly what's going on with that specific individual in order to be able to administer.
Yeah, you have to tailor your therapy. You have to really see if there's an underlying cause.
Right.
And it's not just about doling out a medicine, doling out a pill. It's what are your options and what are the side effects and what's going to be best for that patient.
Right. That's great. So tell me a little bit about your practice, your office. Where is it located?
So I have two offices. I'm in my Delray Beach office Monday and Wednesday mornings.
Monday and Wednesday in Delray.
And then Tuesday, Thursday, and Friday, I'm in my West Boca office.
Okay.
And I see patients every day in the morning.
All right.
And in the afternoons, I go to the hospital and do procedures and surgeries and see patients in the hospital.
How many patients would you say you see at West Boca when you come in?
In the hospital, in my office, I see about 25 patients in a morning, sometimes more. Obviously, you got to try to spend enough time with each patient. But we have a great office, and
you have a very helpful staff. I've heard.
My staff's awesome.
Yeah. What does the process entail? Once.
So usually you have to come to my office if you've never been there before. You have to come 20 minutes or so early. There's a bunch of paperwork.
In a perfect world.
Right. There's a bunch of paperwork you got to fill out. And then I actually really pride myself on getting patients in and not waiting long. I mean, that's so frustrating when you're a patient. You're sitting there waiting an hour or longer to see the doctor. We kind of organize it in such a way where the waits are pretty minimal.
That's great.
Obviously, there's going to sometimes be emergencies or something like that, but our patients, we get them in and we spend the time with them that they need, and then they're pretty happy with that.
That's great.
Yeah. And I've gotten to know my patients since I've been here, since 2008. So I still have some of the same patients.
So you've had your practice since 2008?
Yeah, I started with another doctor.
Okay.
And then he wanted to retire, and I took over his practice.
Wow.
And been doing it since.
Do you have any help at all? Like, are you working with anyone at your practice, or is it just yourself?
I have 5 people who work in our office.
Wow.
Yeah.
Sounds like a pretty big office. I mean, 25 patients a day.
It's not that big. It's good. It keeps it manageable.
Right.
There's obviously a nice community feel because I'm right near the hospitals.
Right. That's great. And also you're, got the latest technologies.
Right.
Latest advancements.
We try.
You try. Well, I really, am interested in learning more about the procedures that you were discussing other than the kidney stones. What else do you...
So there's a lot of treatments now, a lot of surgeries, also new surgeries we're doing for men with prostate, not prostate cancer necessarily, but prostate enlargement. So if a man is having problems urinating and the medicines that we use to open the prostate and to help them urinate aren't really working as well, there are a variety of surgeries, minimally invasive surgeries, that can get these men happy and peeing a lot better. The traditional surgeries usually were big, open, invasive surgeries with lots of recovery. And most of the surgeries that we do nowadays for prostate, non-cancer prostate, are done through little telescopes where we kind of open up the inside of the prostate. Some of these procedures, patients may spend one night in the hospital. Sometimes they may not even need to stay in the hospital.
That's great.
We're using lasers. We're using steam therapy. These are new treatments.
How does that happen? An enlarged prostate, like how does a man suffer from that? Is it something in his lifestyle?
It's usually just genetic, and it's really not something you can control or really prevent. The prostate starts becoming more of an issue for a man when they're in their 50s. It starts presenting as difficulty urinating, or they notice they're getting up a little bit more at night, and stream's not coming out as well.
Right.
They have urgency to get to the bathroom, and they're going to have an accident if they don't get there in time.
Right.
These obviously can be pretty embarrassing.
Right.
So most of the time, we usually start, making sure it's not a sign of prostate cancer and stuff like that, and we can start treating them with medications that can really improve their quality of life. So they're happier. And
That's important.
Yep. Yeah, and
that's important. Still young in your 50s, you got to have an enjoyable lifestyle. So, well, what about women? I know that this happens to women as well when they have to either go with frequency
Yeah,
or...
so that's that overactive bladder, and women come to me when they realize that they're leaking, and there's two types of leakage that women experience. One is called stress incontinence.
Okay.
And that's when women, when they sneeze, cough, laugh, any pressure, and they notice they notice that they're accidentally losing their urine. That kind of incontinence can be helped with pelvic floor exercises, the Kegel exercises. Right. And then there's also some surgeries, minor surgeries with slings that we use to kind of elevate the inside and prevent that leakage. That's stress incontinence.
Okay.
The other type of incontinence, which is urge incontinence, which is the overactive bladder.
Okay.
That's what we had mentioned before, is mostly controlled with, at least initially, with medications.
Right.
And it's a huge market with a lot of medications available.
And you can do the Botox with that.
And then you could do the Botox, and then there's two other options for that. One is something called InterStim, which is almost like a pacemaker for the bladder.
Wow, how does that work?
So you do a test in your office where you test the nerves in their back, because people don't realize that the bladder is controlled by your spine and your nerves in your spine.
Wow.
And you test the nerves in their spine.
Where? Which part of the spine?
Lower back.
Okay,
very
the
lower
lumbar.
back.
Okay.
Yeah, very, very low down. And you test them, and you put this little lead. It's a small, thin wire, and it's attached to a remote control. And the people live like that for 2 days. And if they're happy and they realize that they're not leaking and they're not having the accidents, they're not going through the pads, then you do the procedure for real in like a surgery center or an outpatient center
or West Boca.
And you put these small little leads through their spine. They're asleep, they don't feel it.
Okay.
And then a small little battery, which is almost the size of a pacemaker, in their lower back. And that has a remote. And these people are living like this, and it stimulates the nerve to the bladder. And it controls their leakage,
Right.
Now, there's one other treatment also where you can stimulate the nerves behind your ankle. It's called percutaneous tibial nerve stimulation.
Say that again.
Yeah, that doesn't sound totally weird. You put a little needle in right near the Achilles tendon, which is in the back of your ankle.
Okay.
And you come to your doctor's office and you do these treatments like once a week. And we found
it's kind of like acupuncture.
It sounds so bizarre,
but it works.
It works, and if you treat this and stimulate that nerve, for some reason, due to a reflex arc of the nerve, it controls your bladder. So those are some of the main treatments for overactive bladder, that urge incontinence. There's a lot of options. I mean, a woman should not have to suffer from that.
No, of course not. That's a small price to pay for a good quality of life. So you said that you were in Del Rey on
Monday and Wednesday.
Wednesdays.
West Boca, Tuesdays, Thursdays, and Fridays.
Right. And when do you normally go to West Boca Medical?
Usually Tuesday, Thursday afternoons, sometimes Friday afternoons.
Is this for scheduled procedures?
Mostly for scheduled procedures, scheduled surgeries, or if there's an inpatient who's having a urology problem and one of the doctors in the hospital needs a urologist to consult with, and I come in and see the patients then.
Would the patient then from there come and see you at your office to follow up?
Yeah, typically they would follow up with me and take care of them from there on. That's how we get a lot of patients through the hospitals.
Right. That's great. And you said your practice is right there.
It's right there. It's right across from West Boca.
Where exactly?
It's in the 9970 building on Central Park Boulevard. So if you're on 441, it's basically across from Target on 441. One of those big buildings.
I know where that is. We're actually going to cut to a commercial break. Don't go anywhere. We'll be right back with another important guest. Thank you.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
You and Your Doctor, Living Longer and Healthier, being sponsored by All County Healthcare, a Medicare certified agency. If you have any questions, call 1-888-717-7170. Ask for Maddie. She will answer any of your healthcare questions. This broadcast will be repeated next Tuesday at 11 a.m. and 3 p.m. on 95.3 FM, 1470 a.m. We are live streamed on All County Healthcare Inc. Facebook page and on our website. Today we have Dr. Batayneh, board certified neurologist, and we are here to speak in depth about sleep apnea. Welcome.
Thank you for having me on the show.
Of course, thank you for being here. So tell us a little bit about what it is that you do daily.
Okay, so I am a sleep specialist. So I take care of the patient who have sleep problems. The most common sleep disease is sleep apnea, and other diseases, insomnia, where the patient is cannot sleep well at night, and there's other diseases.
Okay, and what types of patients are you seeing? Are you seeing younger people, older people, generally?
All ages.
Okay.
But again, sleep apnea, and I think that will be the main subject to talk today. It can affect any age, but it affects mainly as the age advance. It has higher risk of developing the disease.
I see. And in developing this disease, what are the causes exactly that you've seen from your experience?
So sleep apnea, again, is a common disease, and there are risk factors that increase the risk of having the disease.
Okay.
Overweight or obesity is a big risk factor to have the disease. Smoking.
Okay.
Smokers have higher risk of having sleep apnea. It affects men more than women.
Oh, that's interesting.
Yes. And again, it affects as we get older, the chance of having the disease is higher.
I see. Okay. Yeah, so you mentioned that health, weight, this can all affect sleep apnea. And I actually have a friend of mine who has a friend of his who recently passed, unfortunately. And he was young and he was healthy. He was 40 years old. Have you seen any cases like that?
Yes. So young people, of course, they might develop those diseases. And the link to the sleep apnea, because sleep apnea might increase the risk of heart attacks or strokes or cardiac arrhythmias, and that might cause sudden death. So it's well known that sleep apnea that might untreated sleep apnea, if they are not treated, because some people either they are aware of it or they are not aware of it, but they don't get medical attention for it.
Right.
It's important to get medical attention, because if it's not treated, it might lead to very severe complications,
Right.
and sometimes fatal complications, such as sudden death from heart attack or cardiac arrhythmias.
Now, what signs and symptoms? I mean, because I can imagine there is a large population that doesn't even realize that they have this condition. What symptoms exactly should they look for in order to know when it is time to come and see you?
So there are many symptoms. The big two is snoring. If they snore during sleep, this is a big one.
How
So,
is this related?
snoring could be a sign of sleep apnea. So basically, sleep apnea when they stop breathing during sleep,
Right.
and because of the airways collapse on each other during sleep. So because of this collapse, so every time they breathe, they produce this noise, which is the
Wow.
snoring. So it's basically, it means the airways is collapsed.
Right.
And this is it's like 90% of the sleep apnea will snore.
Wow,
But
that's very interesting. It's
it
an
is.
important piece of information because there's
Yes.
many people that snore.
Yes, yeah, it's very common medical, it's a common phenomenon, but not all the snorers have sleep apnea.
Okay.
25% of the snorers have sleep apnea.
I see.
Not all of them, but almost all of the sleep apnea patients snore.
Wow.
And the snoring is it's precede the stage of sleep apnea. So the snorers who don't have sleep apnea, there is very high risk of developing sleep apnea later in their
Wow.
life. So it's very important, if you snore or you don't sleep well, don't sleep on it, because it might be a problem.
I see. I like what you did there. So other than snoring, what other symptoms would you say are clear signs of sleep apnea?
They are sleepy during the day. They wake up not refreshed
Right.
and not ready to go.
Right.
They feel groggy in the morning, and they describe themselves as not a morning person,
Ah.
because they wake up, they are not refreshed because they
Tired.
stop the breathing throughout the night, so they wake up tired. And some patients describe that they wake up worse than they went to bed.
Right. More
because-
tired.
More tired because
I've
they
heard
have
that
to,
many times.
yeah, because they breathe hard and the oxygen drops throughout the night. So it's better if you are awake.
Right.
And you don't want this sleep. So they are unrefreshing sleep. They wake up tired and not refreshed. And they continue to be sleepy during the day. They take naps. They doze off.
Right.
They feel fatigue and tired. They don't have the energy.
And this is among all age groups.
Among all age group, and especially in the middle age group, they think, okay, I'm getting older. This is why I feel fatigue.
Right.
You feel fatigue for a reason, and not because it's not natural aging. It's not a normal aging process to feel fatigue. You feel fatigue for a reason, and sleep apnea is a big reason for feeling low energy, fatigued, sleepy.
Wow.
And some people they get by taking caffeine products.
Yes.
So
I
they
see
wake
it
up.
all day.
Yeah, they wake up. Okay, they drink coffee or tea, and they live their life.
Right.
And this is why I think this is the main reason they don't get medical attention, because they
They think
depend
it's
on
normal.
caffeine,
Yeah.
and that makes them awake. But this is like putting a band-aid. It's not treating the cause.
Right.
So
So-
you're treating the sleepiness, but you are not treating the disease itself.
That makes sense. What exactly when should a patient come and see you, and where can they come and see you? Where are you located?
I'm located in Tamarack,
Okay.
and again, if someone thinks that they have sleep apnea is very common. It affects 26% of the American. So almost
26%.
it's almost 1 out of 4 of the Americans have sleep apnea. There was a big sleep study done in Wisconsin. It's called Wisconsin Sleep Cohort Study. 10 of thousands of patients were enrolled, and there was a lot of findings. One of them showed that 26% of the Americans have sleep apnea. But
that's a big number.
It's a big number, and it's underdiagnosed because there is a loss of awareness among the population and even the health providers. Even the health providers are not aware. They know about sleep apnea; it does exist,
Right.
but they don't think of it. And the population, they don't think of it. They snore at night, and they are sleepy during the day, but they depend on the caffeine products, and
Right.
they never get medical attention, which is not the way to go, because you need to treat the disease, because if you have sleep apnea, it might lead to a lot of severe complications we can talk about.
Okay. Let's talk about those complications.
Okay, so untreated sleep apnea, it's well known now, but the big study, this Wisconsin sleep cohort study, showed that sleep apnea might lead to hypertension, high blood pressure,
Okay.
hyperlipidemia, heart attacks, strokes, dementia, memory loss, depression,
Wow.
chronic fatigue, cardiac arrhythmias, congestive heart failure, lung disease.
Crazy.
If it's not treated, that might lead to one or more of those complications. Or, to be more accurate, it increases the risk of having one of those diseases.
Wow.
So this is why it's important to treat. It's how you feel if you snore, if you are sleepy. It's how you feel. But those are signs that you need to have medical attention.
Right.
Because if you have sleep apnea, you need to know about it. You need to get it diagnosed
Right.
and to get it treated. Because if it's not treated, one of those complications might happen to the sleep apnea patient over the years. And the study showed that if we treat the sleep apnea, the risk of those complications are much lower.
Wow. Wow. It's amazing how important it is to catch this and treat it. Can you tell me a little bit more about what your process is as far as from beginning to end when it comes to treatment and trying to identify the sleep apnea?
Exactly. So if someone come, usually another doctor refer them for a reason. Like they have heart disease, or they had a stroke, or they have dementia, or they have headache. And they're trying to see why they refer to me. And some of the patients voluntarily, they come into the doctor because they snore or they are sleepy during the day. But this is the minority because, again, there's not much awareness during the population. So if there's suspicion of sleep apnea, they have the symptoms, they snore or they sleepy during the day, they get a sleep study. Sleep study, there are two kinds of sleep study. They go to the lab, to the sleep lab, and they sleep overnight. There's nothing special about it. The sleep lab, there's a room, there's a bed, there's a TV. It's like a hotel room, and they just sleep. They don't have to do anything. And we record their sleep. And then we'll decide. And then the study comes to me, and I read it. And we decide if they have sleep apnea or not.
Would you say that one night of the study is sufficient data to be able to make that determination?
Good question.
Thank you.
Because, yes, I would say more than 95%. But if we have really high suspicion and it did not show it, we might bring them for another night because it depends on the night. But I would say over 95% it's accurate. But if we really have high suspicion and the first one was negative, we might bring them to another study.
Very interesting. You mentioned that was one type of sleep study.
Yes.
What is the next?
So the other test we can do, which is a sleep study both, but we do it at home.
Okay.
So
how
we do
does
it
that
at
work?
home. Yes. So they come to the sleep lab during the day, and the technician will instruct them how to wear the electrodes.
Okay.
At night when they go home and they are ready to sleep. And we record their sleep at home. And the next day they bring the device to the sleep lab and with all the information. Then I read it and will decide if they have sleep apnea or not. An important point here is that, so what's the difference? Which one should go? So usually in-lab sleep study is much accurate. And so this is their preference. We always go for the in-lab sleep study. But for some conditions, we do a home sleep study. Like the patient, he doesn't want to go to the lab. And as an alternative, we said, okay, this is an option. We can do a home sleep study, or financial, because home sleep study is cheaper than in-lab sleep study.
I see.
So in-lab sleep study, it's always much better than home. But as an alternative, we can do home sleep study.
I see. Very interesting stuff. So after you determine that they do have sleep apnea, what comes next for them?
What's come next? So this is the good news, because a lot of diseases don't have a treatment. So we diagnose, but you know what? But not much we can do about it. Or we can do some supportive.
Or you try things out to see what works.
Exactly. Or supportive. Like we treat a symptom here, a symptom there, because
Okay.
that's most of the neurological diseases. Sleep apnea, there is a treatment. There is. So
Tell me, what's the treatment?
Exactly. And the treatment is very effective. It's a CPAP. CPAP is a machine they put on during sleep. It's a small machine. They put it on the nightstand next to them, and it's connected to a mask, and they wear the mask. And they wear this every time they go to sleep.
Is this administering some sort of medication? Or?
No, it's deliver high pressure. So
Wow.
yes,
Very interesting.
yeah. So it's not a complicated machine. It just deliver high pressure, and so if you because the sleep apnea patient, the airways collapse. So this is what happened. The airways collapse. So to overcome the collapse, you need high pressure in the airways. So if try to collapse,
Brilliant.
it does not collapse because the pressure is high in the airways.
That's brilliant.
So it does not collapse, and the patient continue to breathe throughout the
Normally.
night normally.
That's great.
Does not collapse. You continue to breathe. The oxygen stays up. Blood pressure stays normal. Heart rate stays normal.
Where can I get one?
It's everywhere. Yeah, but if anyone have sleep apnea, it's recommended to make a diagnosis and to treat it, because you know what? Most of my patients, they felt much better on the CPAP because they sleep well at night. They wake up refreshed. During the day, they are more energetic, more alert, not sleepy.
Better quality of life.
Better quality of life. They get to do things that they used to do and they are not doing anymore because they say, I'm too old.
Right.
They are not too old. They have something. We need to figure it out and to treat it.
That's
In this case, sleep apnea. So most of my patients, they love the machine and they use it. Even when they go somewhere, they take the machine with them because it helped them a lot. That's the majority of the patients. I would say 80%. 20% don't like the machine.
Why not?
Don't like it because it's for a comfort issue. You are there all their life. They sleep, they turn, they do whatever they want.
Right.
And now they have to wear a mask, so then they don't like it. They don't like it. But two things to say about this. One is it takes getting used to. It takes some time to get adjusted to it.
So you've got to give it a chance.
Give it a chance. I tell my patients, you won't fall in love with it the first night. You need to use it. And some people don't use it.
Right.
Yeah, they put it aside and that's it. The patients who use it, after a couple of weeks or maybe 1 or 2 months, they start to love it.
They say, you were right, Dr. Batayneh.
Yes, because they feel it.
Right.
They feel it. They are sleep better. They are refreshed during the day and very energetic.
I think I really want to try one.
Try one. If you have sleep apnea, if you don't have sleep apnea, you don't need it.
Well, I wanted to know, do patients come and see you directly or do they have to be referred?
No, they can come directly.
And you said you're in Tamarack.
Tamarack, yes.
Where exactly?
And University Drive by University Hospital.
Oh, okay. Okay. I know the area very well, actually. So tell me a little bit more. Tell me about sleep in general.
Okay, sleep is a necessity.
Of course.
It's not a luxury. That's important. Healthy sleep, like healthy nutrition. You need to sleep well to stay healthy. So some people think, and we have this, even me before I got to medical school, like, okay, sleep, I don't need to sleep. I'm not sleepy.
Right.
Or I have something to do.
Right.
That's okay every once in a while. But in general, you need to sleep 6 to 9 hours every night.
6 to 9 hours.
Every night. And if you sleep less, chronic sleep deprivation might lead to diseases.
Those diseases that we were talking about,
We were
heart
talking about.
conditions.
But not like if you have sleep apnea, but the same. It might cause high blood pressure, it might cause headache, it might cause fatigue or depression, but not all of the above. Not all of the stroke, heart attacks.
Oh, I
Because
see.
those, it's mainly because of the sleep apnea and the drop of the oxygen
Right.
and the high blood pressure associated with the sleep apnea.
Okay.
So it's different. If you really have sleep apnea, it need to be diagnosed and treated. But if you don't sleep well, it increases the risk, but not as much as if you have sleep apnea.
Right.
But the point is, we need to sleep 6 to 9 hours a night so that we stay healthy.
Right. And what habits should people have just before they go to bed? That way they sleep well at night.
Yes, good question.
Thank you.
So,
Maybe I need some help myself with the sleep.
yeah, maybe this is why you have those
This is why I
good
have the
questions,
great
because
questions.
you feel it. Yeah. So, the habits. Let me talk about insomnia. Insomnia is not sleeping well at night. Could be organic or psychogenic. Organic, if there's something in the body that prevent them from falling asleep. Sleep apnea is one of them.
Okay.
There is restless leg. They keep moving their leg during sleep, and they cannot sleep. They might not be aware of it, but it's in the
They're not getting good quality sleep.
good quality of sleep, and they keep waking up. And other organic causes that might prevent them from falling asleep. Which is the majority, the other reason is the psychogenic. If someone has some psychological thing that prevent them from falling asleep,
Like,
depression, anxiety, PTSD, post-traumatic stress disorder,
how many patients would you say you see with these issues?
insomnia.
Is it very common?
It's very common. 30 to 50% of the American will have insomnia, at least one in their life. They might not have a chronic insomnia, not every day, but at least one. So it's very common medical condition, and we see it a lot.
How do you treat something like that?
So that comes to your question now. So if we think it's psychogenic,
Right.
if it's psychological, so nothing wrong with their body, everything is normal, but still they cannot sleep.
Right.
So that's likely it's psychogenic. Psychogenic, it could be because of the disease or poor sleep habits. They don't have good sleep habits.
Such as?
So the advice is for a good sleep habit is they need to go to bed on regular time, on like at the same time every night.
Okay, so a consistent bedtime.
Consistent bedtime. That's it.
Consistent bedtime.
Consistent bedtime. But not to be obsessed about it. But in general.
I'm obsessed with my
Oh,
sleep.
yeah. But you know what I mean. But like 10 or 11 or 12, but not one day 8, the next day 2 in the morning.
Right.
And this become a pattern.
Yeah.
This will cause insomnia. It will cause chronic insomnia. So as you said, consistent bedtime. 10, 11.
Right.
One night 11, the other day 10 is okay.
And if it's 1 o'clock, it has to be 1 o'clock every night, right? If they're waking up late. Let's say they wake up late.
Yeah, 1 plus minus 12 to not every night, but I'm talking about a pattern.
Right.
Yeah, I'm talking about a pattern. Yeah, but again, this is why I said don't be obsessed. Not like still I have 5 minutes. It's not like that.
It's not like work.
Yeah, exactly. But and plus minus.
Right.
That's one advice. The other advice is bed for sleep, not for anything else.
No TV.
No TV, no reading, no iPads, no nothing.
Right.
Because there is something called association. Association is the brain links something to something else. So in this case, it links bed to sleep. So if you go to bed when you are sleepy and just to sleep, this association will be stronger.
And it will be easier.
When you go to bed, the brain automatically, it's a sleep time, you go to sleep. But if you go to bed and you do other activities, watching TV, reading, doing other things, the association will become weaker and weaker. And over time, the brain say, okay, she went to bed because she want to watch TV. They don't sleep.
In my case, that would be me.
Yeah, they don't sleep.
Right.
That's another thing.
How if people wanted to contact you or learn more about sleep apnea, how would they do that?
Yeah, they can call my office.
Okay, what's the number there?
Give me 1 second.
Do you have a website?
Yes. I gave them the phone number.
Oh, I have it here.
You have it.
Yes. So that number is 954-718-9777. You can contact Dr. Batayneh with any sleep apnea. Thank you so much for joining us on the show today. We really do appreciate your presence here.
Thank you so much.
Thank you. You have a great night.
You too.
Thank you all. See us back again next Tuesday.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.